Good morning. Good morning. Good morning. I am Craig Lambert. I'm the Executive Director of the Autoimmune Hepatitis Association. It is so awesome you guys are here, and I think, it's tangible. Just when you get rare disease patients together in a room, we're gonna find out more about who you are and why you're here in a second. But just a few brief words as we get started, and a few things with our board. We've worked so hard to put together this conference, and really this is about you. It's about the relationships you form here. It's not necessarily about this disease. So the meeting aims, just to set everybody on the same page, we want to learn about this disease and related knowledge. Maybe while you're here you get some tools and you can bring some of this understanding back to your doctors back home, wherever you came from. And we may want to just meet others. And I really encourage you to listen to their story and share yours if you're comfortable. There's a lot of wealth there. This experience, again, is focused on overall well-being. This disease comes with a lot of baggage. We'll talk a lot more about it. But we're going to have a wide spectrum of talks, over 30 different speakers. We're going to embrace complementary medicine. We won't hide. We will lean towards it. We're going to have some time for expert conversation. So maybe at the Q&A sessions. Feel free, though, to also find the expert talkers outside their lecture halls. Grab them. Ask them. They're here for you, and they've given their time and effort to produce these slides for you today. You're also going to have an opportunity, if many of you already have, is participate in what we call the GRACE study. This is our study here at Indiana University. We'll learn more about that today. And finally, the possibility of getting a FibroScan for free provided by one of our partners, EchoSense, who makes the FibroScan machine. First and foremost, disclosure. I have to say it, that we do not replace your primary care doctor, your gastroenterologist, or your hepatologist. We cannot diagnose, we cannot treat, we technically cannot manage your symptoms associated with liver disease. So again, take everything with some grain of salt, but again, this is to arm you with the right information when you return home. We will discuss off-label use of medications. And that's important to know that all these medications we use for the treatment of this disease are not necessarily approved for this disease. Finally, social media is incredibly important for us in leaving a footprint for a number of different reasons. We will be taking pictures. We will never tag you. We want to keep your identity private, but we may share this on our social media channels. Some really special additions, and I think many of you have probably already seen some of these pieces we've put in place. I want to introduce Julia Reich in the front right here. She is a graphic recorder, and her time has been graciously provided by the Browner family. She will be here up front in the right alongside speakers, giving a visual representation of what we are talking about. These works of art, and they truly are works of art, will be on display later in the lobby, but it's helped to reiterate some of the important learning principles that we review. She also will be doing some important patient engagement sessions over the lunchtime hour. We're also going to be doing a mindfulness and resiliency program, which close to 40 of you have signed up for and I think is sold out. That is tomorrow morning. This is led by Dr. Shelley Johns and provided by the Smith-Fuquay Foundation. This is a really novel and innovative approach to really give you some tools, again, to manage some of these side effects of this disease. We also have videography. You see them in the back of the room and also upstairs in some of the breakout sessions. This will be professionally done, and this is courtesy of a pharmaceutical company by the name of Intercept, based on an educational grant. The American Liver Foundation is here in the front hall. They also are avid supporters of the AIHA. They are sponsoring a patient perspective session led by Jessica Schnurr that will be one of the breakout sessions this afternoon. And then finally, as you guys have seen and what I've been pushing from last night and forward, the AIHA app. This may be an app that we use for years to come, but this is your go-to conference app. Now, this has everything you need. Really, it's seeing the agenda. You can network with people, share information. If you want to make sure you get their contact information for after the conference, you can actually look at the slides that are presented. They are attached to the agenda. We also have a digital wall, which you can post fun pictures. Please drop any education that you learn and share with others, as well as participate because you'll be put on the live display during the breakout sessions and over lunch hour as well. So if anybody does anybody not have the app on their phone or the availability? If you don't, there's a QR code, a few people putting their phones up. You can also search this on the iTunes or other stores to download it for free. Now, one of the reasons the AIHA is here is really because of Dr. Chawla Sivan. I think it's important that we make just a moment before we move much further. We wouldn't be here without him. He is a David Crabb Professor and Director of our Division of GI and Hepatology at Indiana University. He's actually been a longtime mentor of mine, actually since third year of medical school. He is an internationally renowned hepatologist, and he's had a really successful career in clinical research in alcohol, fatty liver disease, as well as drug-induced liver injury. And again, we would not be here today without the early and really continued support from him and actually his staff. And he has donated wisdom, money, and the time of his staff, hepatologists and gastroenterologists, to really make this happen. He has believed in the importance of supporting patients with rare disease from day one. So I want to introduce Dr. Chawla Sivan.
Thank you. Thank you, Craig. He said to me last night, you have a minute to talk. I was thinking he knows me better. I'm not leaving in 5 minutes, Craig. But this is really very gratifying to see. What started maybe 5-6 years ago when Craig, Dr. Lambert went to medical school here, then he went to Atlanta, then Mayo, and then we recruited him back to IU. We thought it would be really good for him to lead our program in autoimmune hepatitis. This is my 25th year as a practicing hepatologist, and I see some families here that I've taken care of. It's been incredibly frustrating. Nothing really changed in terms of how we manage patients in the last 35 years. It's the same thing, last 40 years. You have a flare, you get steroids, and if it's tough to manage, you add CellCept and Prograf, little tweaks, but really very, very small increments. So it's been frustrating. And then it seemed like a very ripe thing we as a large liver group would start building. And Craig is led our program. And paired with Craig is the patient advocacy group. And at the time, there was a really strong Facebook community, Sharon and others. And I think it's just come along quite nicely. And really, this is yours. You all come here with hope and seeking answers. And really, in a way, this reminds us that the thing that my mentor said, every day you have to think as a researchers, patients are waiting. Patients are waiting for better answers. And I think you all sit here and really challenge us. I know this is a really beautiful program you've put together. For example, mindfulness. I personally have gone through mindfulness exercise. There's a lot of information about its value in patients who are going through chemotherapy, so on and so forth. But beyond this, though, I think the challenge is for us to come up with new paradigms, why this is happening, why some individuals are getting autoimmune hepatitis, why it is hard to treat in some patients. Can we have better tools than managing, or is it each time they have a flare, do we need to do steroids? And I think really challenges for us, and that's the challenge for Dr. Lammert, and I think we have a few other experts, and really so glad to see this come together. I think the board is so robust, and it has, what we started, we weren't sure 5 years ago how this would shape up, but I think I couldn't be happier that how this AIH association has evolved, and I think it'll serve the scientific community as well as patient community quite well. Thank you for being here. Thank you, Craig, for leading it, and thanks to the board for a spectacular job. This is far beyond what I envisioned a few years ago, but thanks once again.
We're going to do something a little fun. Can you put the slide with the QR code for Kahoot? We're going to find out a little bit about you and who is here. So if you have your smartphone, all you got to do is aim the camera right at the screen. And I want patients, friends, family, as all participating in this, just answer these questions as you would answer them, or how your loved one would answer them. We'll leave it up for another. Is it working? Good? So it should take you to a website where you'll enter game PIN. Otherwise, you can just plug in the website into your phone. It's kahoot.it. Let's go ahead and play it. So on that first page where it says enter game PIN, you're going to enter this PIN in 1 moment. All right, enter the PIN, 340156. This will be worth it, trust me. Nicole is the first player, look at that. We're going to give you about another 15, 20 seconds to get, oh, there we go, there's some players. The pin's on the top. We only got 51 players, 53, we're rising. Can we get at least 75? We're going to call it at that. 69, 70. Last few seconds, struggling in, and 75. All right, let's play it. All right, are you ready? So I'll read the questions out loud. You're going to use your phone to respond to these. What statement best describes you? I have autoimmune hepatitis. My child has autoimmune hepatitis. My significant other has autoimmune hepatitis, or my friend has autoimmune hepatitis. So everyone's answering, everybody gets it. Let's see the responses so you know who they're. So it looks like we have a lot of patients, at least 40 that came out, so a lot of significant others as well. But interesting, we have some parents, which is great. And friends here, thank you for being here with your friends. Let's go to the next question. How many miles did you travel to be at the AIHA Patient Support Education Weekend? Less than 30, 100 to 250, 30 to 100, and more than 250. All right, wow, so we have a lot of people from afar away, which is just awesome. I think that just speaks to the power of these conferences, so you're in great company. Let's go to the next question. How long have you or your loved one been living with autoimmune hepatitis, roughly? Less than a year, 1 to 2 years, 2 to 5 years, and more than 5 years are experienced patients. All right. Wow, good spread. We have some experts. So 34 of you, more than 5 years, but we do have some early ones too, so this is an awesome spread as well. So I think this community will bring a lot of experience and maybe even mentor some of the younger onset patients. Next slide. Which one of the below do you think was the most important reason and why you developed this disease? Now you have to lock into one of these. Genetics. Was it a bacteria or virus? Including that maybe medications, a drug, or other. So a lot of people believe they are wired for this disease. I'm interested to hear what the other is, so grab me at some point. Next slide. What is the longest amount you have ever been treated with a steroid for this disease? Please tell me there's not more than 5 years here. Combine it all. I'd like to know your experience. All right, so we got some long-term steroid users, but we have some people still 6 months to 2 years is no joke either. Next slide. Only 2 more. What symptom do you struggle with the most that you attribute to AIH? Fatigue, depression, poor sleep. Most attribute. You guys should, definitely those people talking, that's anxiety, I think. So, fatigue. Fatigue is and that's not surprising. So we'll be talking a lot more about fatigue during this conference. And the final slide. During your illness, have you ever felt AIH has taken some of your identity? So I hate to tell you, I think I knew the answer to this question before we even started. You guys can switch off the thing into the other. So I hear this every clinic I see a patient with AIH. You know, loss of identity seems to be so important, and it's actually, we see it in a lot of other chronic diseases as well. Patients tell me that, you know, this is really the worst part of this disease. It can even go beyond side effects, the daily medications, the daily labs, or frequent labs, I should say, and daily medications. You know, maybe this is one of the reasons you guys are here. During this weekend, we hope you'll find some ideas, suggestions on maybe how you improve your condition. Maybe it'll help you reimagine your future and help possibly reclaim some of that lost identity. Thank you very much.